Hi everybody. Well, welcome to Friday, the new Friday, the new everything. Okay, so I decided I'm not going to give any specific talks today because I'm sure there's tons of questions about vaccines. I'm just going to say a couple of words about the rollout. One thing is GW has started doing the vaccines for the patients. So if you are a DC resident, you can definitely pick GW as the site. And let me show you real brief. So what I'm going to do is I'm going to share my screen and just show you a website. Sorry, don't look at my email. All right, where is the GW update? Right. I think I have misplaced that. Oh, there it is. Okay, so this is the GW MFA, so it's GW Docs, and if you get there, you should see the first upfront COVID-19 updates. And here are the information. So this is the testing centers. I'm just going to skip this down. And here's the vaccine. So currently, this are who are eligible, right? So District of Columbia, 65 years of age and older. Notice doesn't really matter what comorbidities are there. When you go to sign up to the DC vaccine page, apparently there's a way to pick GW as a site. Once you picked it, you get registration. And I know that some of my patients already registered. And apparently there should be an email of some sort that coming with explanations what you should be doing. However, I heard there's some glitches. My understanding that if you somehow did not get the email or unable to figure out what the email is saying, you should call the main number. So main number for GWMFA is this one. So it's just downtown office, 202-741-3000, okay? Now don't call the hospital. It's MFA that's doing the vaccine, even though I don't exactly know where physically is. If anybody have heard of where they're doing the vaccine, definitely let us know. Okay, so that's my only real update for the GW. I think for the DC, for the Maryland and Virginia, the next week is when they're beginning the 65 plus, not just 75 plus. And I'm hearing more and more that Sibley, MedStar, Suburban, those are all places where people can get vaccines. I have not heard a lot about Virginia. If anybody have gotten the vaccine in Virginia, if you guys don't mind, type it into the chat as to where you got it from so that people can see. And I think with that, no, okay, great question, Irene, thank you. You do not contact your doctor. It's a total waste of time. Do not contact any of your doctors. They don't know, and they will not give you any recommendations. You have to proceed through the centralized government channel, but you can designate a place of the vaccination to your, if it's a GW, to GW, if it's Sibley, to Sibley. So, all right, thank you. So there's Inova in Virginia. Multiple people said that Virginia Hospital Center. Yeah, the Arlington, from what I'm hearing, has been very aggressive. They vaccinated several of my patients and actually they did get it in Virginia Hospital. Learner Wellness Center. Thank you. So thank you, JD, everybody. So GW administering the vaccine to patients in a Learner Wellness Center. It's a building. Yeah, so the Safeway is also doing that. All right. Those of you guys who are not muted, I'm muting you, just FYI, so we don't. Okay, very good. Now let's go through the questions. The first question was actually written before we start today. So this was by Lauren. Thank you so much for submitting questions. So question was about long haulers, and thank you for Irene asking, defining the long haulers. So the definition, there's no actual clear definition, but the logic is if it's more than 3 months of continuous symptoms after recovery, then that can be described as a long hauler. I hate that name. It's just it's a really, in my opinion, weird term. Should have come up with something else, but even on GW website, you can see that. So for whatever it's worth. So questions, no, patients are no longer contagious. 2 weeks after onset of symptoms, nobody is contagious. There's no precedent of a sort of non-recovery from infectious phase. So that's a good news. If someone who's vaccinated becomes sick, could they also be possible long haulers? The thinking is no. In both of the Moderna and Pfizer trials, we have not seen anybody who've been vaccinated and having any long-term symptoms. So that's a good news. Is that possible? Well, what's possible is if you gotten the vaccine, but just a couple of days before the vaccine, you got sick. So if that's the case, at least theoretically, it's possible vaccine is not going to work because it doesn't give you enough time to establish the immunity. But I think that's a pretty low chance. So yes, I think the answer to that question is no. All right, what is the big difference between the Pfizer and Moderna vaccines? I think we talked about this, but I'll cover it once again. The main difference is how they handled. So Pfizer vaccine must be maintained at an extremely low temperature at minus 80 degrees. And I think that's basically requires a specialized commercial freezer that are not readily available. So the places that are capable of having those freezers are going to be typically larger institutions, like a large medical facility. So if you signed up with places like GW, Sibley, maybe I know, but there's some chance you're going to get Pfizer. Otherwise, the CVS and sort of all other standard distribution channels that are going to be increasing in number, they're probably going to be given Moderna, which is kept at minus 20, which is a regular freezer. Okay, that's one of the key differences. Other differences are very, very small. Both vaccines are preservative-free and containing PEG. By the way, before I forget, there was one other thing I did wanted to speak to, and that is the news, official news about the anaphylactic reactions. Let me pull up something real quick. So this is the MedPage today. MedPage is a pretty up-to-date source of medical news that's supposed to be written only by physicians, and it's sort of for medical community, but it's also, of course, as well for general public. So they specifically report that it appears that anaphylactic reactions to COVID vaccines is significantly more common than to flu shots, although there hasn't been anyone who passed away who died from this type of anaphylaxis reaction. And the CDC makes a very clear statement that the risk is, here's a good number. So the risk is approximately 1 anaphylactic reaction per 1.3 million vaccines administered. So it's a pretty low risk, and since nobody died, anaphylactic reactions are thought to be, sorry, I think I misspoke, right? So it's 11 cases per million versus 1.3 for the flu shots. So it's about 10 times more common. But, if you think about this, that's a 1 case in 100,000 roughly, pretty low chance. And the recommendation is that those patients who really know they're extremely allergic, it's not a bad idea to make sure you have your EpiPen nearby when you get the vaccine and get it in a more medical settings. By the way, every time vaccines are given, at least theoretically, all the locations, it should be administered by a nurse or some kind of a trained healthcare provider, so who should be able to recognize an anaphylactic reaction immediately. And if you notice, all of the sites where vaccines are administered are some form of healthcare facilities. So they should have not just the staff who can recognize the anaphylaxis, but also a way to deal with this before a patient gets transported to the hospital. Okay. All right, so I'm going to stop sharing and go back to our questions. All right. Thank you, Jennifer. Yeah, I had to become a Zoom expert through all of this. Okay. Irene, if you're still unclear what long haulers are, let us know by chat. That'd probably be easier. Otherwise, I hope I answered that. All right. Donna's question. Follow up to the long haulers question. Is it more likely to suffer a long-term issue if one had serious case, or can one be a long hauler even if he only had a mild case? So this is a critical question. Thank you, Donna. So yes, we think that the more severe illness was, the more likely patient going to have a long hauler effect. However, there have been multiple cases of young, healthy, completely healthy 20, 30-year-old patients having a mild illness and then being incapacitated for a long time after the illness. That they're thought to be not common, but they do occur. So it appears that the length of post-COVID recovery does not necessarily relate to pre-COVID conditions, age, and maybe even though the severity seems to correlate, but it's not an absolute. If you had a mild COVID, you will not have some long hauler effect. So that's pretty clear. All right, let's see if there's any other questions. All right. Clarification, vaccinations at MFA is only for DC residents. That is my understanding. Because DC is, GW is a DC, mainly a DC area medical facility. So I think you must be a DC resident to obtain it. Even if you're, say, Maryland resident, but you are GW patient. For those of you who are in that exact scenario, I suggest that you guys look up your local, the closest facility to you. So Salome, for you, it's probably going to be something in Silver Spring, maybe a Holy Cross. I know that they are administering.
Sorry, I sent you a private message that I'm scheduled to take the vaccine on the 30th at Adventist Hospital in I got lucky.
Good. Perfect. So, yeah, so the Adventist does do it. Thank you. So, and you're at their old campus or the new one?
No, it's going to be in PG
Fort Washington, PG County. Okay.
Yeah.
Yeah, so this is the way to do it. Identify a location that works for you and see, or maybe 2 or 3, and then go through them and see which one can offer it. Right, Anne asking a good question. Can you sign up directly with GW? My understanding is no. And the reason is because the way DC is doing it. Maryland, you can sign up directly with Sibley. Or wait, Sibley, Georgetown, or DC. So how are they doing that? Because I'm pretty clear that on the MFA page, it specifically says that you need to contact the DC government. But you're right, Sibley and Georgetown, you call them. But both of those places have rolled out administration at least a week earlier. So I'm assuming what will happen with GW, they're probably going to update it next week. I now have 2 patients who already signed up with GW. Unfortunately, I don't think either of them are on Zoom today, so that I get exact clarity how they got through there. Okay. Stacia, okay, is it a question or a statement about SARS-CoV-2 total antibody? And by the way, welcome.
If the questioner could unmute themselves for that one to clarify it.
I see. I just somehow got scrolled down too far. Okay, so Stacey's asking a question. I have been extremely careful quarantining, constantly masking, ordering groceries. My annual checkup, they checked my blood for COVID antibodies. Surprisingly, they were positive. Their 6% error rate correct. At no time have I ever felt even, okay. So, Stacia, great question. There are a couple of ways this could have happened. You could have had asymptomatic infection, meaning you got the virus, but you never felt any symptoms. That's totally possible. You're absolutely correct. It could be a wrong test. So you somehow may have a false positive test. You can do two things with that. You can simply redo the same test, but my recommendation is to identify a lab that will do a quantitative, not just a qualitative. Qualitative is plus minus. So are you positive or are you negative? Quantitative antibody test is way more accurate. It actually will pinpoint an exact level. And that is very unlikely to be false positive. There could be a very slight level that could say, well, this could be a very minimal positive effect, and it's not clear what it's doing. So you'll have to talk to your physician to get that ordered. It is a more specialized test, so it's not like routinely you can order it. There's some plus minus antibody tests that I think are direct to consumer now, so they're at no cost. But that's a great question, actually. Now, the key question for Stacia should also be, do I get the vaccine if let's say this is correct test? And the CDC recommendation is yes, because nobody actually knows if those antibodies are indeed protective if you have not actually had COVID. If you have COVID, if you have had COVID, CDC actually specifically says you can obtain the vaccine, but they recommend not to rush through it due to the shortages, of course, and the fact that you're most likely protected. And the new data that I've been tracking seems to say that that protection may be longer lasting than it was thought before. So at least for many months out, vaccines, the original infection seems to still be protective. That's what I've been recently reading. Okay, we're 2:20. Okay, let's go a little further. Maybe we'll go another 7 minutes or so. Okay, so Benit is asking, why is there belief that people can get vaccinated and still transmit the virus? I don't know. It just seems to be circulating. I'm not sure if there is a, well, there are two ways to look at this. If you picked up a virus before you've been vaccinated, you will be transmitting it for a period of time. So that's for sure can happen. Number two, there is actually no clarity that if you're vaccinated, because theory is even if you're vaccinated, you can still pick up a virus, or you will pick up a virus. The question is, after you pick it up, are you going to be able to transmit it? It hasn't been answered. We don't know that. And actually, that's a reason for, at least now, CDC makes it very clear that even if you're vaccinated, you should be still wearing all the protective equipment, at least, you know, although, well, the masks are protecting both. They're protecting you and they're protecting people around you as well. So until I think this question is definitively answered, can you be a transmitter even though you've been vaccinated? Can you get it from someone and then give it to somebody else? But you're obviously not going to give virus from the vaccine. If that was the intent of some questions, that's wrong. So that there is no capacity to become a carrier from the vaccine, there is no virus. Okay, yes, we don't have that. Actually, we do have the same concern with flu. But the flu is simply, I think the issue with the flu is the, that's actually a good question with the flu. Is there transmission after the vaccine? And can somebody be an asymptomatic carrier with the vaccine flu? I don't know the answer to that question. I'll have to look into that. Okay, can we be asymptomatic even with a vaccine? Yeah, that's the key question. And there's no understanding whether that is possible, at least right now. I think it will take a couple more months before those original trials are going to shed more light on this.
Hey, Misha, I see a question about a caregiver. I'm bringing in a living caregiver for my aged mother. The caregiver had COVID. My mom will be double vaccinated by the end of February. Will the presence of the caregiver be safe for my mom?
So actually, your caregiver is the safest possible person, right? So people who have had an active illness recovered, they're the safest ones. Because they are the ones that have the most, at least for the short period of time, right? For as long as we, because with the vaccines, we don't know if the person can be infected and become a carrier for a period of time, even though they themselves protected from serious illness or from death. But it appears that people who had an actual illness, they can get infected again, but it seems to be months later. So, the thinking here is that it is very unlikely. So the safest person to be a caregiver is the one who got sick, recovered, went through the 14-day quarantine, and now working. Okay. Still wear all the protective equipment.
So I think you already answered this, but I had another question about, so can we still get COVID even with the vaccine?
So yeah, the answer is there is a belief that yes, but it's most of those infections are going to be asymptomatic and they're not going to manifest like anything. And since you're already going to be having positive antibody tests after the vaccine, there's no real way to figure that out. So it's only going to be figured out within the research model where they analyze the quantitative antibodies and where they have other ways to look at the vaccine versus the actual viral infection. The regular tests that we order now, they're not allowing to separate that. So it's a more specialized test. Now they are available, those tests to general public, but generally speaking, that was the question that I was trying to address with Stacia. So those questions with the quantitative way of antibodies that you can approximate there, whether there was a natural illness or the vaccine. But there are specialized tests now that are separating vaccine versus natural infection, but I don't think I have access to those yet. Or maybe they are there, but they're specialized lab and we haven't set up our pathway for testing with those yet.
Now, Misha, are there any medical conditions in which it would not be healthy to get the vaccine?
Yeah, we've talked about that before. It's a most important question probably. So if you know you're allergic to PEG, P-E-G, you probably should A, call your doctor, B, don't get the Moderna or the Pfizer because they are containing PEG. And the belief is that all of those anaphylactic reactions, they have been indeed to PEG. In contrast, the, say, flu virus, those are the DNA vaccines that are containing thimerosal if it's a multi-vial bottle, which is the mercury-containing preservative, and potentially traces of eggs because they're made from eggs. So the people allergic to those can have reactions, but it's unlikely that, anyway, so that's that. Other forms of, not really. So the only group that should not be getting the vaccinations, which is what the European, specifically Norway experience have shown, that's extremely frail people in the end of their life in the last 6 months. So basically what this means is probably patients on hospice should not be getting this vaccine. And the reason is pretty obvious because the vaccine itself with the second dose tends to cause symptoms, right? It can cause a short period of fever, it can cause fatigue, it can cause things like, maybe nausea. And so if this happens in the patients with who are extremely frail, bedbound, at the end of their disease, at the end of their life, they can get their symptoms exacerbated and to the point where it can even shorten their life. So Norway have seen over 20 deaths in patients who were in nursing homes, and all of those patients were deemed to have 6 months or less to live. And Norway actually changed their policy and they stopped vaccinating anybody who is on hospice. That's their formal recommendation. I have not seen the same recommendation in US yet, but I'm expecting that within a week or two, CDC is going to come out with this recommendation.
Do we know why the UK mutation is more deadly?
It's not more deadly.
Okay.
It's more contagious.
Okay.
So yes, we do know. The mutations occur in places of the spikes, and the spikes is what causes the transmission, so adherence to the epithelium. And the more adhering the virus is, the more infectious it is. So you need less inoculum. Inoculum is total amount of virus in the air droplet that somehow you inhaled. So the less the less inoculum you need if the UK and African infection versions or strains are present. There is an expectation that this will continue. There will be more mutations. I'm tracking now multiple other mutations. None of them seem to be more deadly, which is, thank God, knock on the wood, that this will continue. But you know, the new strains seem to be more infectious. So probably within a few months, most of the cases of new infection is going to be from some of those new strains, just because they're going to be more contagious.
And just a clarification before we move on to our mind-body session, PEG or PEG has to do with eggs?
No. Okay, so there are two separate things. PEG is it's a sugar-like complex sugar molecule. The eggs, so PEG is in the Moderna and Pfizer vaccines. Eggs are in old style DNA vaccines. So the Johnson & Johnson vaccine that should hit the market any day or get approved by FDA any day, that's the older vaccine. That's the DNA adenoviral vaccine that is likely going to be made out of the eggs. So if you're allergic to eggs, you know. Yeah, it's Anne's question, last question, okay? Yeah, it's hard to figure that out. Most likely you don't know unless you had some reaction to oral PEG. Oral PEG is used as constipation medication and also for preps for colonoscopy. So if you had a bad reaction to colonoscopy, you may want to think about it, but you need to find out what prep you have gotten, because it has to be PEG. PEG is not the only prep for colonoscopy. There are a number of other ones.
Okay, so I think that's our last question for now. Everybody, if you have a question that wasn't answered, you can send it to me. I'm Janet Rodriguez again, and I'll put my email in the chat box, and I'll turn the question over to Dr. Kogan, and he can answer it next week.
All right. I transitioned to a natural environment away from my office. Okay, so it's a new year, and I was thinking what kind of practice to do today, and I decided that for me, this new year started with this book. So I'm going to put it up on the screen. This book called Breath. It's written by James Nestor. To me, it's not surprising that this book is a 2020 bestseller. I'm surprised that I have only gotten it by the end of 2020, but okay. The book is called New Science of Lost Art, and the idea is simple. Most of the teachings we have been taught about breath have been wrong. And what for me was completely, earth-shattering, so to speak, was the fact that most of my breath practices I've concentrated on inhale. And it turned out from physiologic perspective, actually concentrating on exhale is a lot more important. Moreover, a lot of us traditionally have been taught that the breath is all about oxygen. It turned out that actually, if you think that way, you will overbreathe. You will think that the deeper breath, more frequent breath, well, not necessarily more frequent, but deeper breath are the answer. It turns out that's pretty wrong. It turned out that actually depth of breath is not really an issue. It's the length of exhalation. So the longer we exhale, the slower we breathe. It appears to have strong correlation with a good health. And the book starts from covering general topics, but breath related, but then it goes into very specific medical aspects to the point where the practice we're going to do now is what's called a Buteyko practice. It has all to do about training your capacity to hold the breath on exhale more than 45 seconds. So with that, we're going to test ourselves first. I'm going to share the screen again. I'm going to put this timer on. So what we're going to do, everybody can see the screen, I hope?
Yes.
So even if you lay down, you can still do that. So you can lay down for this practice if you prefer, but I'm going to be sitting up upright. Don't close your eyes because you have to see the screen. So we're going to start by just syncing the breath, just concentrating on inhale and exhale. And then begin to anchor your feet. You can imagine the feet are being placed on earth. If you're sitting in a chair, it may be a good idea to just sense the floor underneath your feet. But then imagine your connection all the way into the earth. Okay, so now as you taken a few breaths and you became more relaxed and more comfortable, we're going to take a couple of regular breaths. We're not going to deepen them, we're just going to breathe. Okay, so now everybody take a breath in, just a little deeper than usual. Exhale all the way out. Pinch your nose and then hold your breath, and I'm starting. So what you're trying to do, I'm not going to do it with you, I already did it before. You're going to see how long will it take for you to hold a breath on exhale comfortably. The moment you start feeling you're struggling, you have to stop and you take a regular, slow, gentle inhale. And your part is done. And you're just going to make a mark for yourself how long you were able to hold the breath. For those of you who are really good at this, we're going to run to a full minute. The normal, according to Buteyko, considered to be 45 seconds or more. So if you're not able to hold your breath for 45 seconds on an exhale, Buteyko's recommendation was that people start engaging into the practice that we're going to do next. Okay, so I'm going to stop this and stop the sharing. So the full reason or exact reason to understand the importance of capacity to hold the breath on exhale will be more clear if you read the book. But in short, as I said, it's your personal capacity to withstand the rise of CO2. It turns out that a lot of the issues is not related to the lack of oxygen. We have been sort of misled. To me, that was the revolutionary aspect of the book. Turned out the key aspect is learning to live with much higher levels of CO2. In fact, the whole point is that the higher level of CO2 tend to correlate with better health. And that was the whole of that's, to me, was a complete revelation. I never really thought of it that way. I always knew CO2 had some importance for divers, for people who needed to hold breath for a long time for any reason. But I did not know that that's related to general health. So our practice, I would invite you to sit down if you're sitting or laying down. If you're sitting, again, just begin again to center back into the earth. Anchor your feet to the earth. If you feel comfortable closing your eyes, go ahead and do that. And now we're going to begin inhaling and exhaling as follows. So we're going to inhale on count of 3. Then we're going to exhale on count of 6. 3, 4, 5, 6. Inhale. 2, 3. Exhale. 2, 3, 4, 5, 6. And continue on your own. We're going to do maybe a minute or a couple of minutes. And you want to inhale and exhale both through your nose. So you can obviously see that exhalation here is twice the length of inhalation. Okay, let's take a last 3-6 breath. And now we're going to move to 4-8, so we're making it slower. So we're going to inhale on count of 4, 4, and then exhale for count of 8, 4, 5, 6, 7, 8, and inhale, exhale through the nose. If you feel you're struggling, go back to 3-6, and then just stay with 3-6 while we continue with 4-8. Okay. Now, those of you who feel very comfortable with 4-8, let's do a third breath, which is 5-10. And at home, if you choose to practice this week, you can keep going beyond this to 6-12, 7-14, and etc. to the point where at the end of an exhale, you don't feel your air hunger. If you air hungry at the end of the exhale, go back to a prior count, whatever it's been. So we'll do a couple of 5-10. If you feel you're struggling here, go back to 4-8. If you struggle with 4-8, go back to 3-6. Okay, and now we're going to close this part. We'll do another practice, but this part we're going to close. Just start breathing normally. Don't get off the chair. Stay as relaxed and as grounded as you can. I'm going to bring back the timer. And let's all take a couple more regular breaths. Just not forced, not long. And now inhale. Exhale and begin to hold your breath on exhale and see how long you can hold. Again, we're going to go to a full minute, just in case some of you can do that. This stopwatch is online, or you can use any stopwatch, it doesn't matter. Okay. So I'm gonna stop here with this first part. And I think what I want to do, instead of going straight to the second part, I just want to get comments what people have felt. Is this surprising for anybody? Yes, Anne, thank you very much. That's exactly how I felt reading the book, that holding breath on exhale is contradictory. It turns out that's what the medicine led us to believe. And I first felt it was ridiculous, but I went back to literature, looked some of the references that the book was citing, as well as some others, and turned out that is very true. Capacity of holding breath on exhale is way more important than capacity to hold a breath on inhale. In fact, holding breath on inhale doesn't even really carry significant health improvement associated with it. Turns out that this sort of improvement in health parameter on exhale, or on a way of maintaining increase in CO2 without increase in oxygen, that's what it's all about. So you're welcome to practice this for as long as you want. If you get a book, what we just did is at the end of the book, in the last chapter, in a practical chapter, there are lots of other techniques. And those of you who sort of heard word Buteyko but have no idea who that person is, it's a Russian engineer who actually, after being an engineer, went back into medical school, became a physician, and he developed this whole system called Buteyko breathing system. And book summarizes this, but of course, the body of the work is quite big. And Buteyko had developed system of curing cancer with this method, and his success was so high that it became a standard practice in Russia during 80s and 90s, before invent of newer medications. So with that, I see people keep commenting. We have about 15 minutes. Yes, Wim Hof method incorporates Buteyko technique. It also incorporates Tibetan breaths, or Tibetan fire breath. So, all right. Well, we still have a good amount of time, so let's do the other technique, which I felt like it's pretty important, because we're entering a time where we hope that we will be consolidating and uniting our nation. And so I felt like within that, I think a loving kindness Buddhist meditation would be very appropriate. I do want to thank Nina El-Badri for teaching me this technique and sharing her transcript of this technique. Of course, this technique is done in a variety of different methods, but different texts, but I'll share with you this one. So I'll invite you to find comfortable position again. If you feel you want to lay down, I think it's very appropriate for this practice. And we're going to start by putting one of your hands on our heart, and just bringing the attention to our center of feeling, bringing attention to our current experience. You can feel the warmth of our hand on the chest, maybe a sense of a pressure, sense of a rising and falling of our chest wall with each breath. So now let's bring our hands to our lap. This is a practice of kindness, of loving presence for ourselves and for others. We all have this innate capacity to loving and for kindness in any moment, even when we feel we are in a deep negative territory. This capacity of being gentle, kind, and loving to ourselves and others is still there. So let's remember a last time, or the most vivid time, where you felt a sense of generosity, of kindness maybe a deep gratitude to someone. Not just imagine how it feels, but literally put yourself in the sensation that you felt in that moment. You can replay the situation in your head, or imagine the person or an action or activity that generated that sense. See how your body feels in the moment. See if you want to smile, you can go ahead and smile. See if you feel a warmth somewhere in the body, or some kind of tingling. Maybe you just feel your heart pumping a little harder and a little more excited. Or maybe you just feel that your breath has slowed down even more. Whatever it is, just without changing anything, just pay attention to that sensation. Let's open ourselves even deeper to this experience. So you can imagine that sensation that you felt even deeper. Imagine it as a ever-present, unconditional love that goes not just to you, but to every creature, every being around us. It's not just living organisms, it's everything. It's our entire creation all around us. In a few seconds, I'll be offering us a guidance, the phrases that Nina have chosen from her own practice. And I invite all of us to choose this specific sentence and internally repeat after me. Or if you feel called to say something else in whatever words that come to you, if you're muted, feel free to say those words out loud, but you can also say them silently. May I be happy. May I be healthy. May I live with ease. May I be happy. May I be healthy. May I live with ease. May I be happy. May I be healthy. May I live with ease. And now let's open our awareness even further out into all directions. You can think of any person you want, any being, anything that allows you to widen your perspective. And we can become aware of all the joys and sorrows that all the beings experience in this world. And we're going to, instead of I, say, may we all. And if we can, we're going to repeat this practice 3 times, and if there are other words that you would like to put, may we all be, feel free, or just follow after me. May we all be happy. May we all be healthy. May we all live with ease. May we all be happy. May we all be healthy. May we all live with ease. May we all be happy. May we all be healthy. May we all live with ease. Thank you, everybody. We do have a couple of minutes left. If anybody have any burning question, I'll be happy if I can come out of this comfortable meditative state. I'll answer them.
I have a question.
Be gentle, since I'm the one led the practice today. I may not be instantly going back into my usual academic mind thought process. Yes. Question.
I just want to know, they say if you have special immune system issues that you can kind of get up in the front some kind of way, but they never say how that happens and what you have to do to get that kind of priority. Do you know of anything about that?
Yeah, I don't think it's actually true. I don't think that there's I think what can be done, my understanding is that you could claim that if you feel you should be in a priority group and you have some documentation from your physician, you can still apply even if you don't currently qualify. So let's say you're 50 but you have some kind of a condition. I believe you can still apply and try to get, even though you're not supposed to be in line yet. I think that's the only way to do it, my understanding. But you need to discuss this with your provider. And if that's the case, I believe there's got to be some kind of a letter. But I haven't went through that practically yet, so I don't know if it works. So it's a good question for me to figure out for the next Friday.
Okay, thanks.
Mm-hmm. Yeah, so Benita just typed, I just pre-registered for the underlying condition group in the VA, and they didn't ask for any information. It may be worthwhile, Benita, to have some kind of documentation in case you show up there and they question that. I have not heard that, but I guess it's possible.
I just have a question on the breathing.
Mm-hmm.
So when we exhale, it's not continuously exhaling, but to exhale and then don't do the breathing in or the exhaling?
Okay, so the point of holding the breath was a test of your health according to Buteyko. That was just to give you your baseline. Then the idea is we would do a Buteyko practice for a couple of minutes. We probably did total of, I want to say 5 to 7 minutes kind of. And then retest. But when you're doing the breath, when you're doing an actual 3, 6, 4, 8 or 5, 10, you don't pause in between. So you continuously inhale or exhaling. It's a continuous breath. So inhale for count of 3, exhale for count of 6, 3, 6. And then you try to learn to slow it down. So over time, you want to try to grow that number. If you can get to something like 10 and 20, and I think that, or Buteyko thought that that is, if you can get to that place comfortably, that should equate with 45 plus seconds of being able to hold the breath on exhale.
Go ahead.
And Anne, I totally share with you. To me, it still feels a little off. And you know why? I realized for me, as a martial artist, I always concentrated on a deep, powerful inhale, holding the breath on exhale, and then punch or kick on a rapid exhale. And it got so ingrained into my physical psyche of how I operate that when I read the book and I started paying more attention to my exhale, I realized I hold exhale all the time. And when I did this test, you guys wouldn't believe this, but I could only hold a breath for about 15 seconds. And I've tried it 5 or 6 times and I could not barely go over that number. Versus if I inhale, I can hold the breath for sometimes close to 2 minutes. And that was and I noticed that in a lot of my meditative practices, I was hitting a certain ceiling, so to speak. And the moment I start learning to get my exhale longer, which is now close to 35 seconds, there's a pretty dramatic shift. I mean, I can't even explain the size of that shift. That's probably the largest shift in my depth of practices that I've experienced in the past decade. And it just had to do with the breathing. So I felt like bringing this to you, because to me that was such a new revelation in a new year. That the breath can have such a profound impact on a day-to-day activity, but a mistake, such a deeply ingrained mistake into when I thought I had a good understanding of breathing. Turned out that I still have a lot to learn. So this is my invitation to all of you to also learn your own breath capacity and read the book.
So, Anne, did Dr. Kogan answer your question? You can type it or unmute yourself.
No, because no, to me, holding your breath means nothing's going out. So
That's correct. So you inhale, exhale, and hold the breath on exhale.
So after you finish exhaling, you hold
the
your breath.
Correct. And you have to hold it for more than 45 seconds for that to be considered normal.
Okay, so that's what you mean, hold your breath on exhale. You mean not on exhale, you mean after exhale.
That's called on exhale, correct, yeah.
Okay, so
But you can hold your breath on inhale, so right after inhale, or right after or on exhale.
Okay, so it's just semantics, okay.
Mm-hmm. So you have to totally eliminate all air before you hold. Do what's comfortable first. Idea is yes, you should exhale all the way out. If you exhale very slowly, that's going to eat a lot of time. That's why after you've done the 4, 8, 5, 10, whatever the practice, you want to take a few regular breaths and then repeat the test if you wish. Yes, it's emptying of your lungs. It's a good description. Thank you, Carl. Phil, do you have a question?
Yeah, a question about possible vaccine side effects. Mm-hmm. So I hear that Bell's palsy emerged early on as a side effect. Mm-hmm. And I had Bell's palsy as a kid subsequent to sinus infection. Mm-hmm.
Yeah, it's a good question. So there's very clear that, no, that's not a contraindication and there's no increased risk for you compared to the general population.
Thank you.
We have not actually seen Bell's palsy as a common side effect from this vaccine from Moderna at Pfizer, but it's a common side effect from other vaccines. It's a very good point. Usually Bell's palsy is transitory, so it goes away after a few weeks.
I have a question about masks. Have you heard that cloth masks are no longer effective with the new strains?
No, I wouldn't believe that to be true. So I think it's
it was on the news.
Oh, well, maybe it's on Facebook news, but I'll see if I can find it. I have not heard that yet.
No, my daughter told me.
Well, if you find it, email it to me. You have my email.
Okay, thank you.
No, CNN and other media said that, and they're saying they're recommending medical grade masks from now on, even double masking instead of the cloth mask because of the new strains.
All right, let's talk about this next Friday.
Okay.
Wait, running out of time, and I'll do my due diligence. I have homework to do.
Thank you.
Thank you.
Thank you.
Bye, everybody.
Have a good weekend, everybody.
Have a good weekend.
Have a good weekend. Bye-bye.
Thank you, Janet.
You're welcome.
Bye-bye. Thanks very much. Very good.
Amazing. Bye. Wonderful.
See you all next week.
Yes, see you next week.